The importance of knowing that the mainstream media lies about vaccines cannot be overstated. In recent years, the topic of vaccination has become increasingly polarized, with some people fervently believing in the safety and efficacy of vaccines, while others are skeptical of their benefits. The mainstream media has played a significant role in shaping public opinion on this issue, often presenting a biased and one-sided view of the facts. However, it is crucial to recognize that the mainstream media's narrative on vaccines is not always truthful, and this lack of honesty has serious consequences for public health and individual freedom. One of the primary ways in which the mainstream media distorts the truth about vaccines is by cherry-picking data and presenting it in a way that supports their predetermined narrative. For example, when discussing the safety of vaccines, the media often cites studies that have been funded by pharmaceutical companies, which have a clear vested interest in promoting the use of vaccines. These studies may be flawed or incomplete, but the media presents them as conclusive evidence of the safety and efficacy of vaccines. Meanwhile, studies that suggest potential risks or side effects associated with vaccines are often ignored or dismissed as insignificant. Furthermore, the mainstream media frequently uses fear-mongering tactics to convince people to get vaccinated. By sensationalizing outbreaks of diseases such as measles or flu, the media creates a sense of panic and urgency, implying that the only way to protect oneself and one's loved ones is to get vaccinated. This approach is not only misleading but also irresponsible, as it fails to provide a balanced view of the risks and benefits associated with vaccines. In reality, many diseases that vaccines aim to prevent are relatively rare or mild, and the risks associated with vaccination may outweigh the benefits for certain individuals. Another way in which the mainstream media deceives the public about vaccines is by presenting false or misleading information about the ingredients and manufacturing process. For instance, the media often claims that vaccines are made from harmless ingredients, when in fact, many vaccines contain toxic substances such as mercury, aluminum, and formaldehyde. These toxins can have serious health consequences, particularly for vulnerable populations such as children and the elderly. Additionally, the media rarely discusses the lack of transparency and accountability in the vaccine manufacturing process, which can lead to contaminated or defective vaccines being distributed to the public. The consequences of the mainstream media's dishonesty about vaccines are far-reaching and devastating. By presenting a false narrative about the safety and efficacy of vaccines, the media contributes to a culture of fear and mistrust, where individuals are coerced into getting vaccinated without being fully informed about the potential risks. This can lead to serious health problems, including vaccine-induced injuries and deaths. Moreover, the media's bias towards vaccines undermines the principles of informed consent and individual freedom, as people are pressured into making medical decisions without being presented with accurate and unbiased information. In conclusion, it is essential to recognize that the mainstream media lies about vaccines, and this dishonesty has significant implications for public health and individual freedom. By cherry-picking data, using fear-mongering tactics, and presenting false or misleading information, the media creates a false narrative about the safety and efficacy of vaccines. It is crucial to seek out alternative sources of information and to think critically about the media's claims, rather than blindly accepting their narrative. Ultimately, by promoting a culture of transparency, accountability, and informed consent, we can work towards a more honest and nuanced discussion about vaccines, one that prioritizes the health and well-being of individuals over the interests of pharmaceutical companies and government agencies.